We talked here about Winter's formula, but that's not the only formula that you have to know. Winter's formula works just for metabolic acidosis, but you might have a bunch of other disorders. For example, there is metabolic alkalosis, and then there is a whole host of respiratory disorders. For example, there's respiratory acidosis that could be acute or chronic, or there's respiratory alkalosis that could also be acute or chronic. To try to simplify things so that you don't have to memorize 5 more equations, you can use this box. And this is the magical made-up box that will help you remember equations for all of these disorders. You take an acidosis and an alkalosis and an acute process and a chronic process, and you put the numbers 1, 2, 3, 4, 5, and you let a 6 hang down from the box. So this box doesn't make sense right now, but it'll make sense in a second. Let's take respiratory disorders first. If the primary disorder is respiratory, the compensation should predict the change in bicarb. The change in bicarb will depend on the type of respiratory problem, if it's an acidosis or an alkalosis, and if it's acute or if it's chronic. So the change in bicarb will equal a certain correction factor times the change in CO2. This correction factor can be 0.1 for acute acidosis. It will be 0.2 for acute alkalosis. It will be 0.4 for chronic acidosis, and it will be 0.5 for chronic alkalosis. So instead of memorizing all of these numbers and where they fall in which disorder, you can just use the box. So for an acidosis and an alkalosis that is acute, you can use the factors that are already drawn in there. And for an acidosis and alkalosis that is chronic, you're going to use the factors that are drawn next to the chronic item. As far as 0.3, this is when the disorder is acute on chronic. For both alkalosis and acidosis, you can use 0.3. So let's take this example. Someone had just had a PE, presents with a blood gas of pH 7.52, CO2 of 30, 90 on 2 liters of nasal cannula. They're tachypnic, of course, because of the PE, and their bicarb is 22. In this case, the disorder is acute respiratory alkalosis. I know acute from this story. I know it's an alkalosis because there's alkalemia as the primary disorder. And I know it's respiratory because pH has gone up, CO2 has gone down, reverse is respiratory. In this case, what's the predicted change in bicarb? I know that the predicted change in bicarb equals some correction factor times the change in CO2. Now, if I go back to the box and say acidosis, alkalosis, acute, chronic, 1, 2, 3, 4, 5. I'm looking for an acute alkalosis. I know the correction factor is going to be 0.2. So the change in bicarb is going to be 0.2 times the change in CO2 from 40, which is normal. That means times 10, and it equals 2. I expect the bicarb to drop by 2 points. So from 24, it will become 22, and this is exactly what happened to the patient. Let's try another example, just to clarify how to pick out your numbers. So a person with COPD comes in with a blood gas of 734, 60, 90, and a chemistry that has a bicarb of 32. Now, is this 32 appropriate compensation for the amount of CO2 that this patient has? Now, if you look, the pH is down, CO2 is up. Sorry, versus respiratory. This is a respiratory acidosis, and it's chronic because the question tells you this is a COPDR who is not in an exacerbation. So I want to know, is the predicted change in bicarb correct in this case? So the predicted change of bicarb in bicarb is some factor times the change in CO2. The change in CO2 is 20 points above 40, which is 20. 40 is normal, so 20 is the change in CO2. Now, I don't need to remember which number goes with which disorder because I just need to draw the box and say, this is acidosis, this is acute, this is chronic. So 1, 2, 3.4. Here it is. 0.4 times 20 is 8. So the predicted change in bicarb is 8 from normal of 24. And this will turn out to be 32, exactly what the patient has. Now, what if the patient didn't have a bicarb of 32 but had a bicarb of 28? That means the person has lost bicarb more than has lost bicarb from what's predicted. That means the person has a metabolic acidosis on top of the respiratory acidosis that they already have. While if the bicarb was, let's say, 35, that means the person has retained more bicarb than is depicted by the CO2 change, which means the person has a metabolic alkalosis on top of the respiratory acidosis and on top of appropriate compensation.